We have a lot to cover today, so I'm going to let Dr. Byanmi get started. Thanks. Dr. Byanmi, you're muted.
I apologize. Good morning, everyone, and thank you, Eric. Welcome back, everyone, to our fourth webinar series on the journey to improving health outcomes in rural communities, a roadmap for rural hospitals. We're excited about this week's webinar. We have two special guests, so we're going to be moving forward in terms so that we can hear from our special guest. Okay, this fourth webinar is on engaging community members in designing and implementing interventions to improve health outcomes in rural communities. So we'll be focusing on, we've learned a lot over the last three webinars. And we're going to be focusing on now how can we get the community involved in improving health outcomes in our rural communities and how important it is to have that community engagement. Our objectives for this webinar is to describe the importance of community engagement initiatives that rural and critical access hospitals can implement to improve health outcomes and strengthen community partnerships. Explain the importance of leveraging cross-sector collaborations, empowering community voices, and utilizing available resources to drive sustainable improvements to improve health outcomes in rural communities. And we're saying cross-sector collaborations. We want to involve not only our healthcare community members, but we also want to involve those that are non-clinical, non-healthcare community members. It's going to take all of us to really improve health outcomes in our rural communities. Describe the community health workers' important role in community engagement and improving health outcomes in rural communities. And we're going to have a special guest that's going to really amplify that information for us. And to share examples of successful community engagement initiatives that rural hospitals have implemented to improve health outcomes. And again, this is where another one of our special guests are really going to help to amplify that for us. So again, I'm very excited about this webinar. So the whole idea is that rural hospitals are critical access hospitals and the community working together to improve health outcomes. That our rural hospitals and our critical access hospitals cannot do this work alone. That they are often the center of the community and usually the largest employer of within the community, if not the largest, one of the largest employers within the community. Rural critical access hospitals are improving health outcomes in rural communities requires a partnership with our rural hospitals. So we need community leadership. We need community members working with our rural hospitals if we're really going to make sustainable change and improvements in our healthcare system. So that's really the focus of what this webinar is about and why it's so important. So what is a community? And we talked about this in our previous webinar when we were talking about community health needs assessment. And how do we define community? Well, for rural and critical access hospitals, conducting a community health needs assessment, community, and as we defined before, is typically defined as a geographic area surrounding the hospital that includes the population it serves, considering factors like distance to access healthcare, local demographics, and shared health concerns that often extend beyond the immediate town or county boundaries to encompass a broader rural area that relies on the hospital care. So our community is much larger than what we can just visualize on a map. So what is effective community engagement? I found what I thought was a neat little video to share on a very short video on what is effective community engagement. What do we mean? What are we talking about when we're talking about engaging the community? So I'm going to stop sharing here. And then share. And then here we go. Share. Righty. We're going to.
We want our community to be a fun, safe, and great place to live. In order to make decisions on what that may be, we need to work together and listen to each other. When we do this well, we call this effective community engagement. Let's talk about just what that is. When a decision needs to be made about something that affects us, we often have different ideas about what that should be. We all have different wants and needs. One of our fundamental needs is participation, which is to have a say in decisions that affect us. So, what is community engagement? There are two really important parts to it: listening and speaking. It's also not just one person speaking and drowning out all other people's voices. Great community engagement is a two-way conversation, a dialogue with a variety of voices heard and expressed. In effective community engagement, you are not sure of what the outcome will be when you go into it, as the conversation will influence the outcome. It requires speaking, listening, and understanding all sides of the conversation.
Okay. I thought that that was a very informative, very short video that really put into context what we're talking about in terms of community and community engagement. Because it takes many people coming together with different ways of thinking, but all coming to work toward a common goal, which is to improve healthcare outcomes within the community. And so it's very important that we take into consideration the listening part, the participation. So many people feel that if I get to participate, if my voice is being heard, then I'm taking stake into it. I'm engaged in the process. And so it's so important that we use specific strategies to recognize that everyone needs to be heard and that the ultimate outcome is to improve health outcomes. And how we do that may be different and unique to each one of our communities. So I just wanted to share that. I thought that it was helpful. It was informative. Now, remember, we're going back to our community health needs assessment. And we mentioned before that within our community health needs assessment, that there are certain questions that we answer. Like, what are the health problems in our community? Very important. What are the health? And each community is different. We may have some very similar health problems, but then we have problems within our community that are unique to our community. What factors are behind the health problems we have identified? You know, that root cause analysis we've talked about before in terms of approximately 20% of our health outcomes are influenced by clinical care. But then majority of the influence comes from those non-clinical factors, those health-related social needs that we've been talking about, those social determinants of health we've been talking about. So what are the factors behind the health problems we have identified? And all of that we can glean from our community health needs assessment, which is a very valuable tool. And we've talked about that in our past webinars. But then we began to think about what plan can we put in place to address the identified health needs. Well, now the plan, we're talking about a plan. That's when we began the process of engaging the community within this plan. Sharing with the community, what do we find within these community health needs assessment? And now taking what we found, engaging the community in developing a plan to address those health problems that we've found and noted to improve health outcomes within our communities. And then finally, what resources are available to address the health problems? And we have to work with the community to find out what are those resources that are available. And maybe there's resources that we've never even thought about. That's why it's so important to have so many different people at the table, clinical and non-clinical, healthcare, non-healthcare people at the table to say, how can we come up with a plan that's sustainable, that's impactful, and that can really help to improve the health of our community members? So community partnership and engagement policy in nursing, and I've been a nurse for over 44 years now. I'm very proud to say that many times we say, if it's not written, it's not done. Well, a policy, having a hospital, rural health hospital or critical access hospital, having a written policy that addresses community partnership and engagement is absolutely essential. Because when we have these discussions, we can always go back to the policy and say, this is what we value. We find this is important, and these are the processes and the procedures that we have in place to make sure that we're involving the community, engaging the community in improving healthcare along with our rural health hospitals. So this partnership and engagement policy serves as a set of guidelines that outlines how an organization, in this case, a rural hospital, critical access hospital, will actively involve and collaborate with members of the community in decision-making processes, in program development, and initiatives aiming to building strong relationships, address community needs, and foster a sense of shared ownership and responsibility. Secondly, develops and sustains partnerships and community-based organizations, advocacy groups, and local stakeholders to address the social determinants of health and improve health outcomes in a rural community. So when we gain all of this information that we have through our community health needs assessment, it's so important to take it back to the community and begin that process of developing a plan, identifying resources, and implementing that plan. And so that's what we're going to be talking about. Increased community trust and engagement is essential. When rural hospitals and critical access hospitals prioritize improving health outcomes, they build stronger relationships with the community. This trust is essential for encouraging preventative care, addressing health needs early, and fostering a culture of health and wellness within the community, which is essential if our communities are to thrive. So what are some of the key elements in terms of improving health outcomes through effective community engagement? What are some of the key elements that we're looking at? So we want to build trust in relationships. We've talked about that. Building trust in relationships is key for a sustainable community engagement endeavor in improving health outcomes. Understanding community needs. That's where we're talking about our community health needs assessment. Again, if you're not familiar with your community health needs assessment for your healthcare facility, please become familiar with it. Take a look at what is it that we found within our community, the health needs and concerns of our community members, the people that we serve. Increase accessibility to healthcare. That's a part of hopefully the outcomes of what the plan is, and the identification of resources and engaging with community members. Invest in preventative care and education. Collaborate with community organizations. Collaboration is key. And as I said, collaboration with both our other healthcare organizations and as well as our non-healthcare organizations. With our schools, with our EMS, with our fire departments, with our foundations, with all of those essential, important, non-clinical organizations within our communities. Train and hire locally. Actually preparing, how do you, and their programs, I know Wella has programs to actually train and hire locally, training healthcare professionals locally and hiring locally. Leveraging technology for outreach. We know the importance of telehealth and how we collaborated, and how telehealth was key in terms of during a COVID pandemic. So again, that's so important. Technology is important. Advocate for policy change. There are some situations, some issues within our community that can only change as it relates to changes in policy. So becoming advocates in terms of policy and having those individuals, those groups within our community that can foster that. Track outcomes and report progress is so important, and keeping people engaged in this kind of work. They need to see that, hey, what we're doing is really matters. It's really making a difference in our community, and we're all contributing to it as an entity, as a group. And then evaluation and continuous improvement. We must continue to evaluate our programs, our plans, our resources, see what's working, what's not working, and revise as needed. And so that's so important. So this whole process, this is the key to effective community engagement. So now we're coming to community health workers and community engagement. And like I said, I'm very excited that we have a guest speaker that's an expert in this area. Community health workers play a vital role in bridging the gap between healthcare systems and rural communities, who provide culturally appropriate education, outreach, and support to improve health outcomes. Their role in community engagement is essential and often is seen also as critical in improving health outcomes and increasing access to care in rural areas. And so I'm excited that we have our guest speaker, Dr. Ashley Winterstrom. And if I'm not pronouncing it right, Dr. Winterstrom, please correct me. But Dr. Winterstrom is going to be sharing with us the critical role of community health workers in improving health outcomes in rural communities. And I'm just going to share a little bit about Dr. Winterstrom with you. She's an associate professor at LSU Health Sciences Center, New Orleans, where she directs the Louisiana Community Health Worker Institute. She has been a proud ally of the community health worker workforce for over 15 years. She has conducted extensive research in partnership with community health workers and has co-authored over 60 peer-reviewed publications. Ashley is a co-founder of the Louisiana Community Health Outreach Network. She serves at the state's Community Health Worker Professional Association. She co-led the Louisiana Community Health Worker Workforce Study Committee that informed the development of a Medicaid state plan amendment to cover community health services, health worker services. And she co-leads the Louisiana Community Health Worker Workforce Coalition. She is a founding board member of the National Association of Community Health Workers and co-chaired the organization's policy committee for 5 years. So I think we have a true expert that will be sharing with us. I'm going to stop sharing my screen. Okay. And
All
Ashley,
right.
are you able to share your screen?
I believe so. Let's see.
Okay.
All right, cool. Can everybody see that okay?
Yes.
All right, awesome. Well, thanks so much for the opportunity to be here today. It's great to be with you all. And I love working with community health workers and talking about community health workers. So it's always fun for me. I would love for this to be interactive. So if anybody wants to add anything in the chat or come off mute and ask questions, I really would like to make sure that I'm talking about things that are relevant to the work that y'all are doing on a day-to-day basis. So before I get started, I'm just curious, does anybody have any specific questions about community health workers? It's totally fine if not, but if you do, feel free to throw them in the chat or come off mute and I can try to make sure that I can address those throughout our discussion. I'll just keep an eye on the chat. And if anything comes up, I will try to address it. I am going to spend a little time today just talking about some of the roles that community health workers can do in the context of working in rural communities, but please feel free to jump in. I usually present things like this with my work partner in crime, Catherine Haywood, who is the executive director of the Louisiana Community Health Outreach Network, which is our state CHW professional association. And she is a longtime community health worker. So just know that as I'm presenting, this has also been informed by our state CHW association and longtime CHW. So we're going to do just a little bit of quick framing. We'll talk a little bit about who CHWs are and their roles, a little bit of evidence for CHWs, and then just some possibilities for roles in working with rural hospitals, as well as some financing options. And again, please jump in with questions that can make this relevant for you all. So I always like to start with a little bit of a fun piece. And so we're just going to start real quick. We've got an individual here, and I'm curious, when you see this photo, what do you think this person might need? Thinking about, we do needs assessments all the time. What does this person need? Jump in, respond, or put something in the chat. I see something. Let's see. A life jacket. Yeah, sunscreen. Okay, great. It's funny because he's got a life jacket there in the boat with him, but he might need a little education about the importance of wearing it. Hat and sunscreen, life jacket on, a motor. Okay, great. So point is, we can take a look at this person and identify some things that he needs, right? This is what we do in community needs assessments all the time. But community health workers oftentimes see something very different. So when we see this, when we start zooming out, seeing kind of the whole picture, we see something very different. And if we think about what he might need right now, usually people will say something like a rescue squad or divine intervention, right? He's going to need help in a very different way. And so I feel like that's where community health workers really come in doing, work in our communities, especially in rural areas, really help us understand the broader picture of what's going on within communities, what's needed, what's missing. And they really, in doing that, help us understand social determinants of health, as we were just discussing, how those make up about 80% of people's overall health. All right. So in thinking about CHWs, I always also like to start with a quick definition because this is a word that gets thrown around a lot, or a term, and sometimes people don't know exactly what that means. This is the definition that was developed by community health workers who are members of the American Public Health Association. And we don't have to go into all of it, but the main thing to know is that CHWs are really trusted members of their community. They have a very close understanding of the community served. And that really allows them to serve as a link or a liaison between health and social services systems and communities. And they also are really great at improving the cultural competence of health service delivery. Also important to note, and I'm sure that many of y'all are familiar with this, but for those who might be new to hearing about or working with CHWs, just want to make sure that y'all know that it's really considered kind of an umbrella term. So there are other terms that fall under the umbrella. So sometimes we hear about the terms community health representatives or liaisons or advisors. Sometimes in Latinx communities, they're called promotores de salud, outreach workers, community case managers, navigators. All of these can fall under the community health worker umbrella. And where do CHWs work? That's another question I get a lot of times. So certainly I know some of you are in hospitals, so CHWs can and do work in hospitals. Oftentimes they work with health clinics like federally qualified health centers. Also work a lot with state health departments. So our Louisiana Office of Public Health has CHWs working all throughout the state, who I'm sure that some of you may know and have interacted with. They work at our Medicaid managed care organizations. But by and large, we look at data nationally, the vast majority of community health workers actually work at community-based organizations. And I see I have a little typo in my slide there. That should be CBO rather than COB. Forgive that. And the kinds of things that CHWs work on, they do a lot in terms of cultural mediation. So really helping healthcare systems and social service systems understand the culture of populations that they are trying to work with. And then vice versa, trying to help communities understand the culture of healthcare and how to sort of navigate that system. They do a lot in terms of providing culturally appropriate health education. So I always like to give the example of, here in Louisiana, if we're trying to help somebody maybe lower their sodium intake to better manage their hypertension, a CHW would never tell somebody they can't eat their usual red beans and rice on Monday. They would say, hey, if you like to eat that red beans and rice on Monday, no problem. How can we reduce the salt content a little bit by maybe swapping out some smoked sausage with something a little bit healthier like turkey instead? CHWs do a lot in terms of care coordination, case management, system navigation. They do a lot in terms of providing coaching and social support for patients. They advocate for both individual and community needs. They also work on building individual and community capacity. They do provide some direct services. And when I say that, I want to be clear that these are not clinical services. Sometimes they'll do something simple like a blood pressure monitoring, things like that, but nothing that's intensely clinical at all. That is not the role of a CHW. They do a lot in terms of implementing both individual and community assessments. So sometimes those individual level assessments for health-related social needs or social determinants of health. And then they're also often very involved in community health assessments as well. They do a lot of outreach to inform communities about services that are available at local clinics, at local hospitals, at local health departments. especially regarding things like screening, vaccines. So they do a lot of that. And they also can participate in evaluation and research as well. And all these 10 roles that I just listed are nationally recognized. These are developed by the Community Health Worker Core Consensus Project, which was a national research study that engaged CHWs throughout the entire country to really sort of frame and understand the roles that CHWs do. All right. So what does this have to do with any of the work that you all are doing on a day-to-day basis in terms of thinking about how CHWs can really improve health outcomes? There is evidence, and if anybody wants a list of specific references, I could share them later. CHWs are known to reduce hospital readmissions when they're working as part of a care team and really helping people address their social determinants of health, making sure those social needs are met so that they're not ending up being readmitted to hospital or hospitals, I should say. They are great at improving management of chronic conditions. They are recommended by the Community Preventive Services Task Force for addressing both hypertension and diabetes. They're great at increasing preventive behaviors like cancer screenings. They have also been shown to reduce costs of care. There have been many studies on return on investment among CHW workforce that have come out in the last several years. But I think one of the most compelling is one that was funded by CMS through their Healthcare Innovation Awards. They funded a whole bunch of different types of interventions to improve healthcare quality and reduce costs, but CHWs were the only one that significantly reduced costs, and it was by about $138 per Medicaid beneficiary per quarter, so pretty substantial savings. And then they also address social determinants of health, so they often do that through assessment and referral, and then they also do a lot of community level assessments as well, and they are effective in that. So we see evidence that CHWs are indeed effective at helping people meet those social needs and changing some of the community conditions related to social determinants of health as well. And one simple example of that was actually, there are several good examples, but I can just give you one just very, very brief one. As there's a group of CHWs working together in a community in Arizona several years ago, and they were trying to address a high rate of diabetes. And one of the things they noticed was that there wasn't any good infrastructure for doing outdoor physical activity. So they got together and raised money to put in a walking trail to increase the availability of physical activity spaces for their community. So just one quick example. And so when we're thinking about community health workers and their potential to work with rural hospitals and in rural communities, these are just a few examples. This is by no means comprehensive, just since we have just a very limited amount of time. I just want to mention a few ways that CHWs can be involved in the work that y'all are doing. So one is that CHWs really can participate as members of a care team. Really, really critical that the entire care team understand that CHWs are not doing clinical roles. They're not stepping on the toes of a nurse or a physician or anybody else that might be involved. But CHWs can be really helpful, after somebody's hospitalized, in following up and helping do things like supporting chronic disease management, helping people plan for behavior change. We know a lot of times folks are struggling with things like how to change their diets, how to incorporate more physical activity into their day-to-day, and CHWs are really great at thinking about how they can do that within the context of the community in which they live. And then CHWs are also great at helping people access additional resources that they may need to better manage their health or address social concerns. Again, CHWs also are great at doing things like social determinants of health screening for individuals. So as you all are thinking about, how can we possibly engage with CHWs and help engage with our community more, one way to do that is by involving CHWs in doing social determinants of health screenings for individual patients. If you're considering doing that, one thing to note is that in-person screenings are often more effective. Making this point because sometimes folks are interested in having CHWs do this type of work and they say, oh, well, we'll just have them kind of, sit in the hospital or sit in the clinic and do calls. That's one way to do things, but generally not as effective as having a CHW sit down in person with someone where they can really develop trust. When we think about the types of questions that are on social determinants of health assessments, oftentimes are pretty personal. And so being able to, talk about those things with an individual in a safe location, oftentimes, more effective than doing something via phone. Another really important consideration is that sometimes we think about, gee, we're going to have CHWs do some screening and that'll be great. Really, really critical that there are referral resources for any needs that may be identified. And I certainly know that's something that folks struggle with in rural communities. At times, there are not all of the resources available that one might need and that one might be asking about. So just in the same way that we don't do, screening for cancer if we don't have a referral resource, it's important not to be doing screening for things if we don't have an available referral resource. So critical for CHWs to spend some time in advance identifying where those referrals are, or sorry, where those resources for referral would be. So we want to make sure that there's a local food bank. We want to make sure there's a domestic violence resource referral, all those sorts of things. And then we want to also make sure that if CHWs are finding, that they are identifying a lot of people with need for a specific resource, they should have some mechanism to document that and also advocate for additional resources if something is needed, right? So they can take that back to their supervisor, take it back to the hospital, take it to the health department, wherever, and say, hey, gosh, I'm really finding that a lot of people need a particular resource. How can we address that issue? Is there something that we can put into place? And then again, CHWs can do community assessments and resource development. So they really need flexibility in their roles so that they can develop partnerships. So as an example, if we're finding that CHWs are referring people to or finding needs for food banks a lot of the time, well, then that's great. So is there a possibility that we can expand the number of resources that are distributing food? So for example, maybe they're going to go and develop a relationship with a local church or other faith community that could serve as a site for food distribution. Or maybe if they're finding, gosh, the folks in our community are able to get non-perishables at the local food bank, but they really would love to have more fresh fruits and vegetables. Is there a way to bring a farmer's market into the community or perhaps start a community garden, right? So we want to make sure that CHWs have that flexibility in their role to develop those kinds of programs and partnerships, that we're not thinking of them as folks who are just, exclusively based within a clinic or a hospital. So those are just a few examples of how CHWs can work in partnership with rural hospitals. I know it's super quick, very basic, but just want to give you some, ideas of things to be thinking about. And then I'm just gonna mention this very briefly because this is what question I always get asked, which is, but gosh, how do we pay for CHWs? How are we going to fund these positions? The answer is, I don't have a good answer. There is not a single answer at the national level. This is something that many, many people are working on together. We collaborate on this all the time, but the answer for now is plan for braided or blended funding. For the most part, we're going to need to be getting funding from different sources, right? So one of those is grants. At this point, the vast majority of community health worker positions throughout the entire country are funded by different types of grants. We can also think about creative ways to collaborate. So again, I mentioned earlier, the vast majority of CHWs in the United States are based at community-based organizations. There may be possibilities to work with those CBOs in your community that already have CHWs or outreach workers or community liaisons or whatever they may be called there, where a hospital could pay for a portion of their salary and maybe the CBO could pay for a portion of their salary. There are also opportunities to consider collaboration with our Medicaid managed care organizations. All of Louisiana's MCOs have community health workers on staff. They may not call them that, they're called different things, but all of them have CHWs in some capacity. Oftentimes they're working on a very specific program, but there may be possibilities to collaborate with those folks, right? Because they have the same goals that all of us do in terms of improving health outcomes. So if they already have, say, a CHW that's working on a perinatal health initiative, maybe there's an opportunity to incorporate that particular person into the work that you're doing at your hospital as well. So just an example. Y'all may have heard about this already, but you should be aware that there is Medicaid reimbursement available for some community health worker services for some Medicaid members. That's a longer story. I can give you all the details about that in a different context. but it is possible under very specific circumstances to bill for some CHW services. The services do have to be billed by a licensed provider. So basically a physician or an advanced practice registered nurse has to order the services, but then CHWs can be reimbursed. The reimbursement rate is relatively low. It's $18.11 for a 30-minute encounter with an individual, which is generally not going to be enough to make up an entire salary given the nature of CHW work. But it is something, and it is one opportunity to bring in some funds for CHW work. And then finally, just as of last year, the new physician fee schedule that Medicare released in 2024 allows for some CHW services to be supported. CHWs aren't specifically listed, but they can be supported under a few different mechanisms or codes. So there's community health integration, social determinants of health risk assessment, and principal illness navigation services. I've listed the codes here in case anybody is interested in that, but just be aware that the reimbursement rates here are much, much higher under Medicare. So for some of these, it is $80, roughly almost $81 for a 1-hour encounter, and then an additional $50 for each additional 30 minutes. So that can have a real potential to fund some CHW work. Important, especially in the context of thinking about rural communities, CHW travel time is not covered. But if an individual CHW is working with an individual patient, really helping them, figure out how to better manage their illness, a CHW can bill for the time where they are spent seeking resources related to social determinants of health. So if we're trying to get somebody housing, if we're trying to get somebody access to healthier food, and it's directly related to the main illness that they're addressing, that can be billed under Medicare for Medicare recipients. All right, so I have talked a lot. That was super brief overview of a whole bunch of different types of topics around CHWs. I hope that's helpful. I'm happy to answer questions if we have time. If not, this is my contact information, so please feel free to reach out. And then I've also included here contact information of Catherine Haywood, who I mentioned earlier is the executive director of our state CHW Professional Association, LaShawn.
Ashley, thank you very much. You are definitely a wealth of information, a tremendous wealth of information. Will you be able to stay around until the end for
I can
questions?
stay till noon. Sure, you bet.
But I do want to ask you one thing. Do you find that CHWs, there are different challenges or unique challenges for CHWs in rural communities versus in urban communities?
Yeah, I think that's a really good question. And the answer is yes. I think there are a couple of things. One is just the availability of resources. Again, I mean, I live in New Orleans. In urban areas, we're very lucky to have a lot more resources. So I think that lack of resources can be a challenge. One other thing that's come up, and I'm sure there are other issues as well, but one, I remember I was doing some work out in Point Capee Parish many years ago, and the CHWs we were working with were talking about how confidentiality is a totally different topic there, just because, if they're going to say do a home visit, everybody in the community is going to say, hey, why were you over here and why were you over there? Everybody kind of knows everybody. So that's one. And then again, just travel time is a big one. Especially some of the CHWs who are working with the Office of Public Health are covering multiple parishes in rural areas. So they just spend a lot of time driving. So they don't get to see as many individuals and support as many individuals. And then it's also just challenging in terms of funding those positions because so much of the time they're spending is in the car traveling.
Thank you very much. Thank you.
Sure.
What we're going to just move on. I'm not sure if Kathy's here, but I hope that she is. I'm going to go ahead and share my screen. Okay. Let's see.
Dr. Bieniemy, she said she was going to be on in about 5 minutes.
Okay, awesome. That I think that'll work fine. Let's see. All righty. And so we're moving now to from the role, important critical role of community health workers to improving health outcomes through community engagement. And what I wanted to do is to share just a small video about one community in Missouri that how they used community engagement to really focus on how they could improve health outcomes. Gonna stop sharing now and see. And keep in mind, they're going to be mentioning the Delta Region Community Health System Development Program that provided funds for this. But I don't want you to focus on that right now. I just want you to focus on what the engagement part, the community engagement, and the impact that it had on improving health outcomes.
Helped us to dream bigger. And in helping us see that bigger picture, see where we fit into the community, what we add to the community, we have become a better, stronger organization.
Washington County has 625 square miles to get to another emergency room. We have a lot of chronic illness, a lot of preventable diseases that we're just not catching or taking care of because people have lack of transportation. And unfortunately, a lot of it's generational. What our community needs a lot of times is somebody to just put the pieces together. But to me, that was the bringing us all together collaboratively for the best needs of the community. Working in partnership with the great minds, the Department of Health, community partnership, EMS, working together to make sure that we used every possible resource that we could as a community. It's just so important that the healthcare providers in our community work together. We can all do our own thing and we can duplicate services and there can be gaps in services.
The training from the Delta group helped us better identify community partners that may be more invisible to us, that had something to contribute that we may not have been aware of.
To make sure that we were hitting on all the right needs of our community was essential and something that we wouldn't have done individually, but we could only do with the Delta resources.
We did our first events in conjunction with the FQHC just a half-mile away, Great Minds Health Center, that was also in the Delta program. We ended up with about 20 plus community leaders at our first meeting. After that, the work continued. Then we ended up with 30. Then we ended up with 40. We had over 60 organizations represented at our last workshop that we just hosted this past July.
It was so well attended and well received. It's been one of the biggest community partner events that I've seen in a long, long time.
One of the priorities that came from our Delta Community Priority Action Planning Workshop was the need for support for patients. Support for patients that were struggling with substance use disorder and or a mental health disorder. We were blessed in the fall of 2022 to receive not one, not two, but 3 rural community opioid response grants, one of which was focused on behavioral health and gave us 3 community health workers for the next 4 years.
want to be able to provide the individuals in the community that we serve the preventative education, provide them resources that they may be lacking, or even if it's something as simple as assisting them in filling out a Medicaid application.
Those 3 community health workers have helped our patients with their mental health needs, substance use disorder recovery. They have also helped them apply for Medicaid.
It is really important that our hospital do well, and I believe that it's thriving. Medication errors were reduced by 75%. Hospital-acquired infection was reduced by 70%. Grievances went down 60%. This was all during COVID, so that was really profound for us.
The Delta program provided me with education that I needed, very specific to the tasks that they set for me as community champion, and also education that was broader in the hopes that I would be able to use it to help my community. It has allowed our coalition to dream bigger and to frankly have more resources to accomplish our goals.
It was a wonderful process. I mean, it was fantastic. It's a lot of work, but one that you'll not regret as a critical access hospital.
Okay, I'm going to stop sharing. And now I'll go back here.
Dr. Bayemi, Kathy is on. She's not
Okay.
feeling well, but she was able to
Oh.
join us.
Oh. Well, what we and I appreciate Kathy coming on. What we've just seen was somewhat of an example of what Kathy was going to be presenting to us in terms of using community engagement interventions to improve health outcomes. I thought that video was just an excellent representation, even of what Ashley has shared with us and the role of the community health worker and the importance of bringing many different entities together to determine what resources are available and what resources we can innovatively develop and come up with to really provide for the improvement of health outcomes, to address those health-related social needs, those social determinants of health in improving community. Kathy, I'm going to read your bio sketch, but I want you to one of the reasons that I asked Kathy to be a part of this webinar was because we had a conversation, and she's the community champion for West Feliciana Hospital, and she shared with me some of the exemplary work that they've been doing in terms of engaging the community to meet those health-related social needs. And so Kathy is a healthcare business development. She's a Six Sigma Master Black Belt strategic specializing in marketing, communications, and public relations within the healthcare industry, with over 25 years of experience working with rural community hospitals and physicians. She brings her expertise on how to create and implement solutions to bridge gaps in healthcare access and outcomes within rural communities. And so, Kathy, if you're not feeling well, I mean, if you just, whatever what you want to share would be great. And we understand, and because we're going to have a little time for question and answer at the end, along with Ashley and possibly yourself. So anything that you would like to share would be wonderful.
Well, thank you. And I apologize that I am late to the webinar. Going through the program and looking at our community in a whole and how we can all work together and utilize our resources from partnerships to address any of the factors that impact health outcomes. It's been really beneficial for us. Developing those relationships with the partners has not only helped with outreach to the community, but providing different resources that the actual residents have, their needs. And it's, you know, I don't know how you want me to focus on this, if you want me to talk about the partnership portion of it or identifying the actual needs in our community and how we went about that.
I think identifying the actual needs and how we went about it. We've had a lot of discussion on identifying needs, but then what do we do when we identify the needs, kind of?
So, when you identify the needs, we noticed when we did this that there were several different avenues that we could go down. But we wanted to make sure that we stayed within our core of what we do here at our hospital, along with our clinics. We identified needs of services that we don't have. And we identified needs of the community of services that we do have. So those needs the services that we don't have to address some of the needs are some of the long-term strategies that we can look at. But one of the biggest needs that we saw was mental health in our community. And we have an IOP program. And so we had services available. We just needed to enhance those services and figure out a way that we could reach the community with mental health resources. And so other areas that we identified, prenatal care and OBGYN type situations, we don't have those services here. Would we like to have the services to offer to our patients? Absolutely. Or to our residents? Absolutely. So in those instances where we didn't have the services, we reached out to different organizations to help fill those gaps. And services to provide maybe even transportation to get a rural resident to the city where they could have prenatal care. Maybe we equipped our EMS crew, because we own our own EMS, that when they get a 911 call for an OB patient, what type of processes that they can go to help, and then bringing that information back so we could reach out on behalf of the patient to outside partnerships to provide them with resources for that service that we don't offer. So there's just all different ways that you can address the needs of the community. But when you identify some of those needs and you don't have the services, you got to figure out a way that you can get that community resident the services. And that's when you start relying on your partners. It's tedious. It's a lot of work. But once you start working through the process and have all of your needs identified or and your services matched up with them and your partners in place, it just becomes continues without necessarily having to spend a lot of time hands-on with that process. I don't know if that is kind of clarifying what I'm.
You're doing a great job. You're doing a great job, and I truly appreciate it. Can you identify one, if you had to say, this is what I'm most proud of in terms of the outcomes as it relates to the outcome of some of the work that you've done?
So what I think that I'm most proud of, and I think our organization is proud of, we really identified the need of patients either coming to the facility or to a provider, and because of either transportation issues or they couldn't leave work or different things that would affect them from coming in. So we had a lot of no-shows. Our providers that aren't employed with the hospital, our other community providers, they were having no-show issues. And we saw an uptake in EMS calls, 911 calls to our EMS department to go out to the resident, where if they would have sought medical care earlier, or they wouldn't have had to have that call. So through the Delta program, we came up with a solution to do a community paramedicine program. And we are just getting ready to launch that program. And what we'll be able to do is work with our employed providers and our non-employed providers to assist them with no-shows by having a paramedic go out to the person's home and be able to put their hands on that person and do some type of a telemedicine call. They can draw labs, do different things like that. But the second part of that is being able to provide the resources through our partnerships and our community partners in the community. If you have a person that might be a frequent flyer, I think is kind of how we've identified them, that call because they've slipped and fell and the EMS has had to go out to them several times, that they might need medical equipment or different things to help assist them to live in their home. And we're able to rely on our community partners to get them those types of either equipment or services. A good example is we had an inpatient last month, and she was an elderly lady and she had broken her hip. She couldn't be released. If she was released, she had no means to get in and out of her house in a wheelchair. She had the funds to build a wheelchair ramp, but didn't have the availability of contacting a contractor to do all of that. So our paramedic actually reached out to some community partners, and we ended up building her a ramp. It was all donated products and such, but when she was released, she was from us. She was able to go home to a wheelchair ramp and have access in and out of her house so she could make her follow-up, visits. So that kind of coordinates into the community health worker. But that's what we're really proud of, that we're able to start providing that type of service for our community.
Well, thank you so much, Kathy. That's truly an exemplar of what we're talking about right now, and the importance of community engagement and the impact that it can have in truly improving health and healthcare outcomes. So I truly appreciate, and you did a great job, and I pray that you feel better really soon.
I'm so sorry. I sent you an email earlier this morning, and then I got the email from Eric. I'm like, oh no. So thank you for being patient with me. I apologize.
Well, thank you so much. Thank you. And we just have a few minutes, but what I'd like to do is open it up to any questions for both Ashley and Kathy. If you have any questions, you can put them in the chat, or you can raise your hand, or you can just unmute and ask the question.
And while we're waiting on questions, just real quickly, if you all could complete the evaluation survey, it's gonna be in the chat. Amanda just put the link.
I know I want to thank both of you for just great information. I think we could have a whole hour seminar just listening to either one of you. The community health worker, I think is again very critical in the work that we're talking about when we're talking about community engagement and improving health outcomes. Ashley, I was wondering, because right now we're talking about funding and ways to fund. I was even thinking about, foundations, and which is so important, I think, in engaging. Could you share a little bit about that?
Sure. I mean, I'm like I said, I know the vast majority of CHW programs are funded by grants. Many of those are federal and state grants, but I think foundations do a lot of work as well. Are there specific questions you have regarding foundation funding?
No, just mainly as another source of funding within the community. And do you think that educating community members that may not be familiar with community health workers and what they can do are also potential other sources of funding? I'm trying to think of in community and funding sources.
Yeah, I mean, I think that's one of the biggest challenges with the CHW profession in general, is just that folks are not necessarily familiar with CHW. So we definitely need to do more outreach just about the profession so that folks know who CHWs are, why they're so important, so that if they are a patient or just an individual living in their community, they're going to be more likely to engage with CHWs. But then also from the healthcare and public health system, it's important for everybody to be more familiar with CHWs. And so there may be opportunities to engage foundations to support that kind of work.
I'd kind of like to add on to what Ashley was saying with that. I think trust is a big issue with the community and like with us, the community paramedicine or the community health workers, because they are unfamiliar with the programs. But I think once they're engaged, they see the benefit and they're able to help with, word of mouth. It spreads through organizations and your different community partners, but it's the unfamiliar territory. I think that healthcare facilities are always thought of as, we're the medical place. They don't look at us as assisting in different needs that community members have. And I mean, it can be everything from food to, a hospital bed to somebody to pick the person up and take them to the grocery store. I mean, it's just the different things that you can do, but trust is a really, really, really big is a barrier, I think.
Absolutely.
Well, thank you. I think we're just a little past. I wish we had more time because I know I've learned a lot in what has been shared, and I see the great potential that community engagement and the work of community health workers can have in improving healthcare, especially in rural communities. We're at 12:02, I think, and so we're just showing the slide that shows what our next webinar number 5 in the 6th series of webinars will be on tracking progress, determine the impact of interventions to improve health outcomes in rural communities. I think we've even hit a little bit about on that in terms of, really seeing some exemplaries in terms of what can be done, both through Kathy and Ashley. So we really thank you and appreciate you being here. I'd like to thank you. And we ask again that everyone be sure to do the evaluation. The link is in the chat. And I think we'll also be sending the slides and you'll have the link as well. But again, I thank you so much to both Kathy and to Ashley for taking time out your busy schedules to be here with us and to share. And Kathy, I hope you feel better really soon.
And I'm so sorry.
No, nothing to be sorry about. We appreciate you being here and sharing with us. So enjoy the rest of your day, everyone. And thank you for taking time to be with us today. Thank you. See you in 1 month. Bye-bye.